Hello there viewers, and welcome to this important video on a topic that affects millions of people worldwide: iron deficiency anemia. Do you ever feel exhausted even after getting a good night's sleep? Do you feel weak and out of breath after climbing just a few stairs? Do you ever wonder why your skin looks pale or your nails are brittle? If you have experienced any of these symptoms, you might be suffering from iron deficiency anemia. Iron deficiency anemia is a common condition that occurs when your body doesn't have enough iron to produce hemoglobin, the protein in red blood cells that carries oxygen throughout your body. Without enough iron, your body cannot produce enough healthy red blood cells, which can lead to fatigue, weakness, shortness of breath, and other serious health problems. But don't worry, this condition is treatable and even preventable. In this video, we will discuss the causes and symptoms of iron deficiency anemia, as well as some iron-rich foods and supplements that can help increase your iron levels. We will also talk about the proper dosage of iron supplements and how to make sure you are getting enough iron in your diet to prevent iron deficiency anemia. So, if you want to learn more about this important topic and how to keep your iron levels balanced, make sure to subscribe to our channel and watch until the end of the video. Let's get started. What are the causes of iron deficiency anemia? Iron deficiency anemia is a common condition that can have several causes. One of the most common causes is a lack of iron in your diet. Your body needs iron to produce hemoglobin, the protein in red blood cells that carries oxygen throughout your body. If you don't consume enough iron-rich foods, your body can't produce enough red blood cells, leading to anemia. Blood loss is another common cause of iron deficiency anemia. This can occur due to heavy menstrual bleeding in women, bleeding in the digestive tract, or other types of bleeding. When you lose blood, you also lose iron, which can lead to a decrease in hemoglobin and the development of anemia. Iron deficiency anemia can also occur during pregnancy when the body needs more iron to support the growth and development of the fetus. Additionally, certain medical conditions can interfere with the body's ability to absorb iron, such as celiac disease and inflammatory bowel disease. Other factors that can increase your risk of developing iron deficiency anemia include being a vegetarian or vegan, having a history of gastric bypass surgery, and having a family history of the condition. If you suspect that you may have iron deficiency anemia, it's important to speak with your doctor to determine the underlying cause and develop an effective treatment plan. In the next section, we'll discuss the symptoms you should look out for. What are the common symptoms of anemia? Fatigue, feeling tired and lacking energy, even after getting enough sleep or rest. This is a common symptom of anemia because the body is not getting enough oxygen due to a lack of red blood cells. Weakness, feeling weak and having difficulty performing everyday tasks such as climbing stairs or carrying groceries. This is also related to the lack of oxygen in the body. Shortness of breath, feeling out of breath or having difficulty breathing, especially during physical activity. This occurs because the body is not getting enough oxygen to the lungs. Pale skin. The skin may appear lighter or paler than usual. This is because the body is not producing enough red blood cells to give the skin a healthy, rosy color. Chest pain. Feeling pain or discomfort in the chest area, which can be a symptom of more severe anemia or heart problems. Rapid or irregular heartbeat. The heart may beat faster than normal or irregularly due to the lack of oxygen in the body. Cold hands and feet. The extremities may feel cold or numb due to poor circulation caused by anemia. Headaches. Anemia can cause headaches due to the lack of oxygen reaching the brain. Dizziness. Feeling lightheaded, dizzy, or faint can be a symptom of anemia, especially when standing up or exerting oneself. Brittle nails. The nails may become thin, weak, and brittle due to the lack of nutrients reaching the nail beds. Hair loss. Anemia can cause hair to become thin, brittle, and fall out more easily. Developmental delays and behavioral problems in children. Children with anemia may experience delayed growth and development, as well as behavioral problems such as decreased attention span and irritability. What are some dietary sources of iron that can help prevent and treat iron deficiency anemia? Now that we have discussed the symptoms of iron deficiency anemia, we can move on to talking about the different foods and supplements that can help increase your iron levels. Iron-rich foods are an important part of treating and preventing iron deficiency anemia. Eating a diet that is high in iron can help increase your body's iron stores and prevent anemia from developing. Some of the best food sources of iron include red meat, poultry, fish, beans, lentils, tofu, fortified cereals, spinach, and other leafy green vegetables. In general, animal sources of iron, such as red meat, are more easily absorbed by the body than plant sources of iron. In addition to increasing your intake of iron-rich foods, you may also need to take an iron supplement to help boost your iron levels. Your doctor can recommend the appropriate dosage based on your individual needs. It's important to note that taking too much iron can be harmful, so it's important to follow your doctor's instructions and only take the recommended dosage. In the next section, we'll discuss some tips for increasing your iron intake through diet and supplements. What are some tips for incorporating iron-rich foods and supplements into your diet to prevent iron deficiency anemia? Now that we have discussed the importance of iron-rich foods and supplements for treating iron deficiency anemia, let's dive deeper into some tips for incorporating these into your diet. One way to increase your iron intake is to eat a varied diet that includes a mix of animal and plant-based sources of iron. This can help ensure that you are getting enough of the nutrient from different sources, as the body absorbs animal-based iron more easily than plant-based iron. You can also increase the absorption of iron from plant-based sources by eating them with foods that are high in vitamin C, such as citrus fruits, berries, or bell peppers. Vitamin C helps the body absorb iron more efficiently. If you have difficulty getting enough iron from your diet alone, you may want to consider taking an iron supplement. These are available over the counter and can help boost your iron levels if you are not getting enough from food alone. However, it's important to talk to your doctor before starting any new supplements, as taking too much iron can be harmful. When taking an iron supplement, it's also important to take it with food and avoid taking it with calcium-rich foods or supplements, as calcium can interfere with the absorption of iron. In the next section, we'll discuss the recommended daily intake of iron and how to know if you are getting enough. What is the recommended daily intake of iron, and how do you know if you're getting enough? The amount of iron you need each day depends on your age, sex, and overall health. For example, adult men need about 8 milligrams of iron per day, while adult women who are premenopausal need about 18 milligrams of iron per day. Pregnant women need even more iron to support the needs of the growing fetus. But how can you tell if you're getting enough iron from your diet alone, especially if you're a vegetarian or vegan? One way to find out is through a blood test, which can determine if you have iron deficiency anemia. In the following section, we'll explore some additional factors that can impact your iron levels, such as medical conditions and medications. Medical conditions and medications that affect iron levels. Now that we have covered the recommended daily intake of iron and how to determine if you are getting enough, let's take a closer look at some medical conditions and medications that can affect your iron levels. Certain medical conditions can increase your risk of developing iron deficiency anemia, such as gastrointestinal diseases that affect the absorption of iron, chronic kidney disease, and some types of cancer. In these cases, it may be necessary to take iron supplements or receive iron injections to maintain healthy iron levels. Some medications can also affect your iron levels. For example, certain antibiotics and antacids can interfere with the absorption of iron from food and supplements, while aspirin and other nonsteroidal anti-inflammatory drugs, NSAIDs, can increase the risk of bleeding in the stomach and intestines, leading to iron loss. If you are taking any medications, it's important to talk to your doctor about how they may be affecting your iron levels and whether you need to adjust your iron intake or take supplements. Thank you for watching this video on iron deficiency anemia. We've covered the causes, symptoms, and some ways to increase your iron intake through iron-rich foods and supplements. Remember, iron is an essential nutrient that helps your body produce red blood cells and maintain overall health. If you suspect you may have iron deficiency anemia, it's important to talk to your doctor about your symptoms and undergo a blood test to confirm the diagnosis. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more health-related content. Also, don't forget to share this video with your friends and family who may benefit from learning about iron deficiency anemia. Your support helps us continue creating informative videos. Thank you again for watching, and we'll see you in the next video.